Absolutely thrilled to have you. And I have to say that you all know this, that I am not from Ocala. So for me to get to know Ocala the way I've been able to get to know Ocala, I am so impressed with what this community, both the county and Ocala, have done to make us feel so welcome. And every single person that I spoke to would say, oh, you have to call this person, or you have to call this person. I'll gladly give up some of my time so that we can share this to the community. So I can't begin to tell you how thrilled I am to be able to do this and host this roundtable, which you will hear a little bit more about today. So with that, I am now going to ask, you've already met her, our Commissioner Sarah Dean, but not only is she going to do the pledge, she is actually on active duty. She is a specialist in the Florida Army National Guard. So Sierra, come on up and start the pledge.
Standing, beautiful. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please be seated.
Thank you, Sierra. Well, on the tables, you will notice that we have this, which is the study that this event is based on, that was done, and you're going to hear a little bit more about that in just a few minutes. And so I wanted to make sure you have that. And in here is information about the panelists, and this is important because when I introduce the panelists, I'm going to give you their name, and then I'm going to tell you their organization, and then everything about them is in here because we don't want to take the time up away from the great information they have reading all of their bios. So the way the program's going to run is that we have 2 panels, 45 minutes for presentations of the panels, and then at the end of each panel will be time, about 10 minutes, for a Q&A that you can ask them any questions you might have from what they have brought up. Now, I will tell you, each of these panelists could do the entire program just themselves with all the information they have. So this will be jam-packed. And then they have all said that they are staying after. Some of them have brought information on these tables that are on the side, so you can ask them questions, gather information, and take back their wisdom within as you filtrate back into the community. So with that, I want to say that we are absolutely delighted. The commission is so thankful for the Ocala Metro CEP Foundation. And with that, I want to bring up Natalie McComb, who they have graciously sponsored the lunch and the coffee station for us. So can we give Natalie a warm welcome as she comes up?
Thank you so much. I am so excited to be here today. I will tell you that when we got the call that the Florida Commission on the Status of Women wanted to have an event in Ocala, I said, first, okay, tell me more about your organization. I said, 2, why Ocala? And in learning more about the organization, one of the things that struck me was it talked about coalition and it talked about collaboration. And that is what I think of in Ocala. You think about all the organizations represented in this room, how much we collaborate, right? How much we look at issues and we say, you know what, with your help and your help and your help, we can really address this issue and we can tackle it. And that is the thing about Ocala is we all come together. We're a big, small town. And so I can think of no better place to have an event like this that is so focused on collaboration and on research and on taking that research and saying, now what do we do about it, than Ocala. And when I started talking about, okay, well, who do you have on the panel? You know, we can make some suggestions, and they started running through the list and I said, okay, that's a killer panel. we want to be there and we want to host you guys because you have some amazing folks on your panel that are doing the work, that are doing the hard work, that know the issues that we're facing in this community because they see it firsthand and they know the power of collaboration when we come together. So we are very honored and thrilled to host this event and to play a part in bringing this organization and to really, have the privilege, given that this is a statewide organization, to be able to have it here in Ocala. So the Ocala Metro Chamber and Economic Partnership Foundation, we've been around since 2019. We were established as the 501c3 fundraising arm for the CEP. As the CEP started to get more into community work, as we started to invest more in entrepreneurism, as we started to invest more in our diverse communities, as we looked at how we could tackle talent development, the foundation is such a key part of that because we all know that great ideas need great resources. So that is what I have the privilege of doing for the CEP, is finding a way to bring these resources together so we can not only address what we're currently working on in the community, but we can look at some bigger ideas and say, you know what? Let's collaborate and let's do something. So I have the privilege of being here. I want to thank all of our panelists for taking the time today. Please take this study. As you all know, the CEP loves studies, right? We commission a lot of studies because we know that data tells the story. Often, of course, for people who may not be from our community. So please take that, pore over it, because I think hopefully this is just the beginning of some discussions we can have on how we can address these issues and how we can work together to make a difference. So thank you.
Thank you, Natalie. We are just so fortunate that they did this. And in addition, I really want to thank those with the Weber Center. We have, I don't know if Cheryl Crosby's still in here, and Dina, they have been fabulous. They have made sure that all of this went off flawlessly. So when I tell you that we are just thrilled with the reception, not only making all the working pieces work, but to make sure that every single thing, and we met the right people, I can't even express how deeply in gratitude we are. Also, I've got, I'm so lucky, we've got two of our staff people in the back. Wave, Kim and Danielle. They have been incredible in helping and making sure this all goes smoothly. So in addition, all of you are special guests, but I do have a couple special guests that I would like to introduce. And one is from State Representative from District 24. That is Ryan Chamberlain. Will you please stand so we can say hello? Thank you. From U.S. Senator Marco Rubio's office, we have Constantina Vervitas. Thank you. Thank you. And from State Representative Stan McLean's office, District 27, we have Jennifer Trieber. Thank you. Triber. Tried. Now it is my great pleasure to introduce our amazing chair of the commission, which not only is she our chair, she is a proud Army veteran, and that is Sophia Eccleston, who's going to speak to you for a couple minutes.
Thank you, Commissioner Wallace. Good afternoon, everyone. Wow, good afternoon, everyone. All right, that's more like it. Before I go into my remarks, if I could please ask all the commissioners that are here in the room to please stand and be recognized. Thank you. These are the commissioners who volunteer their time to ensure that we do the great work that we do at the commission. So thank you to all of them. So as Commissioner Wells mentioned, my name is Sophia Eccleston. I am the chair of the commission, going into my second year as chair. In my real job, I work for NextEra Energy out of Palm Beach County. I help Fortune 500 companies with their sustainability goals. And this commission, I was was appointed in 2018 by CFO Jimmy Petronas, and it's just been an honor serving on this commission. So I want to give you a little bit of background of why we're here and why we're doing this roundtable. A few years ago, the commission looked at how can we've been doing a lot of events and talking about different issues, and we've done internal surveys, but we really wanted to know, because we are a statewide organization, what are the true issues affecting women and girls within the state of Florida. And so we partnered with University of North Florida Research Lab to really do the survey, and that's a survey that you all have on your table. And it's real. I hope that everyone takes some time to really read the survey, because there's a lot of information in there. And so one of the things we decided to do as a commission was to look at the issues in each region of the state and hold these roundtables and discuss the topics that are really important to those women within those areas. So that's why we're here in Ocala. We wanted to, financial and healthcare was one of the issues that were the women in Ocala said was important to them, and we wanted to come and we wanted to bring these amazing panelists and speakers that we have that can really shed some light and bring you some resources. Maybe there are things that you hadn't thought about, maybe there are resources out there that a lot of women don't know that's out there, and to help address those. And the ultimate goal from these roundtables, and this will continue into 2024, we will take that information and we'll make sure it's part of our annual report, which we then share with the legislators and especially our appointing authorities, which is the cabinet members and Speaker of the House and Senate President. So we really hope that you enjoy this. We plan to do this, even though you're in Ocala, it would be good to video record all of these, and you can go on our website and you can watch them, because I'm sure you will be able to take one nugget away from just some of the information that we share. So with that, I'm going to turn the program back over to Maria. Thank you for being here, and we just hope that you enjoy this program today. Thanks.
Thank you, Sophia. So with that, we are actually ready to start the program. So I am going to bring the first panel up, which is going to be our financial panel. I'll call them up by alphabetical order, and we are going to get this started. So I'm going to invite Yolanda East she is the Executive Director of Shepherd's Lighthouse. Next is Carla Greenway, CEO of Interfaith Emergency Services. We have Cheryl Martin, Director of Community Services for Marion County. We have Beth McCall, and she is the Executive Director of Marion County Children's Alliance. I have April McDonald, the Executive Director of Project Hope of Marion County. And last but not least, Carrie Thiel, CEO of Early Learning Coalition of Marion County. Let's give them a warm welcome. And I get the hot seat in the red chair. So ladies, you all just bring so much to this community with what you offer. I've been pretty astonished at the services that people within this county have. And so with that, I'd like to kick it off with Cheryl Martin. And as I mentioned, she's with the Marion County Community Services. And since you represent the county at this roundtable, would you please address the programs the county has identified to serve the vulnerable population, and what challenges this county faces in this endeavor?
Hi there. Thank you for inviting me to speak at this, and it's lovely to see all the faces in this room, and we work with many of the organizations here, and the organization sitting up here with me as well. The county community services oversees many federal and state grants based on our population. The grants that we receive are non-competitive for the most part. There are some that are competitive. I like to refer to us as the unconventional lender for our county, where we're able to serve the underserved population. And for the most part, all of the programs that we fund, we distribute to many of the local nonprofits here in our community, many of which you guys have already received some funding. And they're going to share the programs that they do that we've funded, so I'm not going to steal their thunder. But the 3 priorities that the county has identified as needs is we need to increase our affordable housing supply. The second is we have community development. So a lot of our community development block grants are used to fund infrastructure projects and low-income census tracts. As we speak to a lot of our for-profit developers and trying to understand how come housing supply is delayed, some of the costs that are passed on to them is a strain. So by allowing us to fund water sewer lines and road improvements helps defray some of that cost for those developers. And then the third priority is reducing our homeless population. And so a lot of the panelists here may speak to that. And so what we want to do is increase affordable housing, increase wraparound services that will address mental and behavioral health so that our vulnerable population will be remained housed. And the challenges that we're facing is we have an ever-growing population. We've got increased inflation, interest rates, supply and demand, which delays projects and how they move forward. But for the most part, I think that's it. And little plug, every January, we do a request for application for our funding. And so that can be found on our website. The community services is www.marioncountyfl.org. And we'll make announcements on social media. We'll do technical advisory. So nonprofits, for-profits can apply for funding to help move some of these initiatives that we have in our community. And then we do offer, I forgot to share this, we do offer 2 direct service programs in-house. One is for, we used to call it first-time home buyer program, but as long as you don't own a home, we do offer down payment and closing cost assistance for low-income families to purchase a home. And then we do housing renovations for people that own their homes, such as roof, HVAC, well, and septic. And those individuals can call our office and receive an application, and we'll help serve them. So and I'll turn it over to the next.
Great, thank you. And just so all of you are aware, this panel was chosen because with the financial needs of this community, what it really is the underemployed, the unemployed, and housing. And that's what we are really focusing on today's panel to make sure that gets covered. And Cheryl, that was great. You certainly quickly covered some major programs out there. So next we're going to do something a little unusual. We have teamed up 3 of the members here to sort of do a subgroup of the group because in many ways they do some of the same things but in different areas of the community. And so that will be Yolanda East from Shepherd's Lighthouse, Carla Greenway from Interfaith Services, and April McDonald from Project Hope. So ladies, share with the audience, you really do collectively meet the homeless crisis here in Marion County. So what resources are there for women in crisis for short-term and long-term housing? And are there programs in place to make sure that they don't end up back in homelessness?
Thank you. I'm Carla with Interfaith, and I'll start because our services are more emergency based. They are more quick and short term, whereas the other ladies that they're on this panel, they are more the long term solutions. So Interfaith Emergency Services offers an array of services to assist women and families that are in crisis or that are in need. We have a food pantry where we offer grocery assistance, and a lot of people think, oh, that's nice. But quite honestly, grocery assistance can make a difference whether or not someone becomes homeless or not. If they don't have to buy groceries this week, they might have enough money to pay their rent or their utility bills and stay sustainably housed. So we don't take that for granted, that it's a little bit more than just giving someone a meal. We serve about between 400 and 500 families a week through our pantry ministry. We also support a lot of single mothers in this community through our Food for Kids backpack program. The majority of children in that program come from single parent households, and that program sends food home on the weekends to children that have been identified by the school personnel as being at risk of hunger on the weekends when they're away from their free lunch and free breakfast meals. And so that also supplements households that most of the time women are running, trying to help make ends meet. We also have a medication assistance program, and that affords people who do not have insurance and can't afford their prescription medications a way to get those medications and follow the doctor's orders, because a doctor doesn't prescribe unless he knows you need it. So it's really unfortunate when someone suffers when they don't need to. When we have a medication we can help them with that will end that suffering or give them a better quality of life. And then also we have a homeless shelter. Our homeless shelter focuses on women and children. We do allow men to come in if they're attached to a woman or a child, but our focus is primarily on women and children because we feel like they're even more vulnerable if they're on the streets. And our shelter program is, again, it's more of an emergency basis. Women will come in and they can get a night of shelter, 2 or 3 nights of shelter. If they're willing to stay and engage in services and receive the help we have through case management and counseling services, they can stay 2 to 3 months until they can successfully transition out into their own housing. And we support that with a lot of other services. Like we partner with Freedom Clinic. If they need dental care, we try to get them connected to get their dental needs met. We have another ministry or another clinic called Hope Clinic that does free primary medical care. And then we also try to get people connected to Heart of Florida so they can get access to health care ongoing. And then we supplement that by providing their medications. We also started a couple of years ago providing mental health counseling to every woman that comes through our shelter. And it was fascinating to see the difference in their success rate on transitioning out. And about 90% of our women do transition out successfully and are stably housed and hopefully don't need our services again. But they still can be supported with all of our ancillary services, for clothing, food, and those kind of things, and the medication. But when there's openings at my partner agency, Shepherd's Lighthouse or Project Hope, it's a beautiful thing when we can transfer women there because they do get that ongoing continued support to make sure that in the long term they're going to be okay. Our problem, probably our biggest challenge in this community, is just the beds. We don't, we're always at capacity. We tend to call each other and the answer is, sorry, I don't have a bed. Or sometimes they'll move people around. we'll move heaven and earth to try to accommodate when we can. But that's probably our biggest challenge. And so a lot of people might think, well, we duplicate services. I guarantee we do not duplicate. There's enough business for all of us to be busy, and but we do collaborate and work together so that we don't want to leave someone on the streets if there's an empty bed that they can take and then better themselves. And with that, I will turn it over to I guess Yolanda.
Hi, my name's Yolanda East, and I'm the executive director of Shepherd's Lighthouse. I've been in business in Bellevue for 23 years. My whole idea in the beginning of being the founder of Shepherd's Lighthouse was to pray for women and rock babies. That's all I wanted to do. And over the 23 years, of course, things happen, life happens, and program develops. We have what we call our 3 O's there at Shepherd's Lighthouse. The first one is on campus. We have a case management focused shelter. We can house 4 women and 8 children at any given time. They're allowed to stay at Shepherd's Lighthouse for 6 months, and then we transition them into our off-campus, which is our 6 one-bedroom apartments, where they are ready housing first, and then we try to get them housing ready to move them in so that they can pay for their rent and things like that, so that eventually they move into more of a permanent situation. Then we have a lot of outreach that we do in the Bellevue area. We have a group down there. It's called that we founded. It's called BASS, which is Bellevue Area Social Services. And that particular group pulls all of the agencies, all of the churches, everyone that is doing something for the homeless in our area. We come together once a month and we find focused solutions to help what's going on in the streets of Bellevue. I will say that we are the recipients of several of the grants here in Marion County. What we do with those dollars is we actually pay upfront cost so that we can move families, not only women and children, but we move families into a more permanent situation. We collaborate with Carla and Interfaith with the DV domestic violence bonus dollars. We did not realize, but this year that really came into play whenever the domestic violence center closed. All of the agencies were slammed and we had to step up to the plate and try to help the most vulnerable in those situations, which we will continue to do so. We are the kind of company that doesn't want to leave money on the table. So if there's grant dollars out there, we're going to apply for them. And we do have 4 people on staff, but there's only 2 of us that does the case management. And Teresa Chambers is my case manager. I have to give her the high five, because whenever the domestic violence center closed, she, even with my direction, I told her we can't do anymore, but she kept on trying to get all these women and children into a safe and relocate them into a safe situation. So we ended up helping 39 families out of that domestic violence center, and it ended up being 103 with the moms and the kids. Now, that's not counting all the other ones that we do with rapid rehousing dollars and our transitional housing dollars. I would say that any of us, Carla, and well, anybody here on this panel, we have a very strong heart for women and children, and we're not gonna leave them astray. And if someone calls us, we try to refer them if we can't help them. We have families from here all the way up to Pennsylvania, across to California, and in Alaska. I have my very first client that I carried her baby in. Her daughter just graduated from high school, and she still stays in contact with us. So when you get connected and make that investment into Shepherd's Lighthouse, it's an investment for life. These women not only get someone to walk alongside them, we don't walk behind them, we don't push them, we don't walk in front of them, we walk directly beside them. We find out what their needs are, and we try our very best with what we have. And this county needs more dollars for case management so that we can hire more social workers to help us, because a lot of us depends on these grants, and we depend on the kindness of others to donate to our programs. And without us, I don't think this county would be able to do what it does to help the homeless. So I won't talk anymore, but I will be over there at the end, and if you have any questions for me, please come over and talk to us. Thank you.
Good afternoon, everybody. My name is April McDonald. I am the Executive Director of Project Hope. And sitting here listening to these ladies, it always just touches my heart that, sometimes you hear collaboration and you really, that's like a cliche, but I can tell you that without this panel and some of you in the room, that we truly couldn't do what we do. And so the beautiful part of that collaboration is that, as Carla mentioned, when somebody has an emergency need, when they truly are on the street, they truly do need any basic, anything basic in life that sometimes we often take for granted. Interfaith always steps in and helps them. And then, Project Hope, let me tell you a little bit about Project Hope. We are more of a transitional supportive housing environment. We have 40 units on the northeast part of town to where we fully furnish them for the ladies. Our program is designed more for women who are ready to be self-sufficient, and the way they get ready is other organizations like Interfaith, and sometimes even from Shepherd's Lighthouse, as Yolanda said. We're really good at, and I'm going to brag on this for a bit, we're really good at identifying the needs for women. You know, it may be personality issues. It may be they need a little more than what a particular program can help. But when we talk about collaboration, we're just not saying that. We truly do collaborate and look at, we are dealing with, you know, when you talk about homeless women, and I get really passionate about this because a lot of people think it's a choice. I can't imagine anybody who wakes up every day and says, I want to be homeless under the bridge or on a neighbor's, you know, couch with my children. There's so many challenges that we as women face already. That's the last you know, challenge for a woman is, listen, my kids, we see it all the time. Women making choices that maybe are not ideal, but just to make sure that their children are okay. And that's what I love about all of our programs. I'll speak for Project Hope. Our program is one of very few programs that I know of to where I would say we are lower barrier. If a mom has experienced some challenges, let's say she has a felony in her background or she's been evicted multiple times, we can't turn those women away. And I think just not here in Marion County, but across the state, that mindset has shifted to you have to meet people where they are. You have to meet these women where they are. You have to assess their individual needs. And so at Project Hope, we do a lot about self-sufficiency, and we are a Christian program. So we talk about these ladies becoming who God has created them to be. And sometimes really what that is just the restoration of dignity. When they walk in and they've been there and you hand them or make them handmade things are so amazing for them. A welcome basket to say, we see you. We may not be there right now, but we see you, we hear you, we want to help you get on the right track. And so we do have challenges, as Carla and Yolanda have talked about. What our current challenge is our ladies can stay in our program. It used to be 12 to 18 months. We were seeing some challenges. There's nowhere to go. Affordable housing is a very relative term. Affordable housing for our ladies is just not realistic. And so we champion and we get loud with it, championing. We have to have somewhere for these ladies to go because we will never send them out not better than when they came to us. And so what we've done at Project Hope is decided is, we're going to have to do something to keep them here, or we say, you've completed our program, you've done great stuff, but there's nowhere for you to go. So we've added an additional level to our program called Hope Rising, to where the expectations are a little lower. They don't have as many life skills and things, and they can mentor other ladies. But I will echo that. The challenge is, after we've done all the work, I say that our programs, our partners, the collaboration, once we've done it, our challenge is, where do they go? Because these are people sometimes don't need a second chance. They need a third and a fourth and a fifth. I know I have in my life. So we really see that. We share that. We laugh. We cry. We do those things because this is a hard population. They are deserving people. They are good people. And just to see, and I know Cheryl mentioned it too, our county, there's not ever been a need that I have not been able to call on and say, we have this need. When you say mom and child, this county, we are blessed with the wraparound. Wraparound service means something totally different here. We are wrapped around with support and love and blessing. So I could go on and on, but I know I have a time. So thank you.
Thank you. You see why I got so passionate about these panelists coming to speak to you. So next I'm going to move to Carrie Thiel. She represents the Early Learning Coalition. And can you tell us what is available to improve childhood literacy, and what kind of support do you have for women to improve their parenting skills?
Great. Thank you for having me. So as far as childhood literacy, it's a big problem here. And if you read my bio, I'm recently from North Carolina, and one of the things that I found to be true is our issues are the same everywhere when it comes to early childhood. Some of the stats are different, but basically we have the same issues. We're sending children to kindergarten, they're not ready. And here in Marion County, the most recent stats that came out, we only have a 35% kindergarten readiness score. We are the second lowest in the state. Take a minute and think about that. So what happens when a kid's not ready? A child, I shouldn't say kid. A child is not ready for kindergarten. We see third grade reading scores matching that same rate. So our third grade reading scores are 39%, just about even. We have to address this. If a child's not reading at third grade, and everybody asks, why do we talk about third grade reading scores? Why are they so important? Well, one of the reasons is that in those first few years in school, children are learning to read. In third grade, they begin reading to learn. So if they don't have those skills, school life is pretty miserable for them. And what we find in some studies and research is that children actually make the decision, most of them, to drop out during the third grade. And it's not that a child says, oh, I'm dropping out now, I'm not going to finish school, but they've made the decision that school is not the place for them. They don't feel successful. They don't have the support. And when you're that far behind, your trajectory is not good. So we have to start early. Great question. What can we do? So here in Marion County, we're making some changes with the Early Learning Coalition. The main thing that we do there is we provide child care subsidy for our children and families, which is a federal block program that provides child care vouchers for parents who can't afford child care. Which is a lot of parents. Unfortunately, the threshold to provide child care subsidy is pretty dire. There's still a lot of parents that can't afford it. It's an average of about $10,000 a year per child to put them in child care. And for some, that's like paying a university tuition. So when we have so many cards stacked against our children and families, we have to come in with child care subsidy and give them that push. So they can receive a voucher if they're working or they're in school or a combination of the two. We also address families who are in a homeless situation, and those children are pushed to the top of the waiting list because they are prioritized, as are our special needs children. So that's the first step. We want to get children in a quality child care facility that can help them develop those early literacy skills. One program that we're going to start, we did receive some American Rescue Plan funds. I wish that they were ongoing funds, but they're those crazy one-time funds, and you got to make an impact with them. And so we're going to do the best we can. But we're going to begin the Dolly Parton's Imagination Library here in Marion County. I'm really excited about this. I come from North Carolina. It went statewide there a few years ago. And by the way, Florida and legislators and representatives, if you go statewide with Dolly Parton, she'll come to the state for a big celebration. So you push that through the legislature, she'll pose with you, and you get a lot of great PR with Dolly. So just throwing that out there. She's awesome. I was actually there when she came for the celebration, and I got to meet her. So Dolly Parton's Imagination Library, if you're not familiar, is a program that provides a book to a child in the mail every month for free up until their 5th birthday. The books are developmentally appropriate. They're culturally diverse. Dolly has a big heart for this. And she started the program because her father had issues with literacy. So that's one of the things that we're doing. We're also starting, just started last week, a program called Kaleidoscope, Play and Learn. It is an evidence-informed program that is set up for children who aren't in any kind of licensed child care. So you think most kids are getting something, right? They're getting something before kindergarten. But our stats say we have around 76% of our children not in any kind of licensed child care. That's a lot of kids. And we wonder why all these kids are showing up not ready for kindergarten. It's because they haven't had anything. So we're going to provide these play and learn groups so they can get the socialization. They can have the peer interactions. The parents can have the peer support that they need. And there's a heavy element of pre-literacy skills that are involved in the Kaleidoscope program. So those are two things that we're doing. We've got some other things in mind that we're working on, but literacy is something near and dear to my heart, and I hope that we can, as we move along, establish more and more literacy programs. Our funding doesn't really cover a lot of that, so I'm going to be reaching out in the community and hopefully get all this love that I hear up here going towards our literacy programs for our youngest children.
Thank you so much, Carrie. Next, I'm going to move, last but certainly not least, is Beth McCall, who is the Executive Director of the Marion County Children Alliance. And you really go sort of hand in hand with, I was noticing your head shaking yes to a lot Carrie was talking about. And so what programs do you have for children when there is neglect and drug addiction or mental health issues?
So thank you for having me here and partnering with all of these on the panel. The Children's Alliance, our mission is to improve the lives of Marion County children. And in order to do that, you have to look at the good, the bad, and the ugly. And unfortunately, many of you that are guests in our county are probably not aware, but we are a 1,500 square mile county, which just in itself is problems with our women and our children and some of our families. The Children's Alliance is very involved. We actually host the Community Council Against Substance Abuse. We also have a family violence prevention work group. And people look at me and go, well, why in the world would a Children's Alliance be involved in that? Well, the two reasons that children are removed from their homes is because of substance abuse and domestic violence. So we have to be involved in all of that. Through the Community Council on Substance Abuse, the opioid, and it was the heroin task force that was formed. It is now the opioid and addiction task force, which is a very strong task force in our community. And out of that, many good initiatives have actually come about. Through the hospital district, represented today by Deb Velez, Beacon Point, and Ann's over there, Beacon Point was started, which is really a full-service resource for folks with substance abuse, and they take women. When I took this job in 2018, I began to look at the numbers of our substance-exposed newborns born at Advent. It was then Brand X, I think somebody called the hospital a few days ago. Now it's Advent. And was absolutely astonished at the number of babies born with substances, drugs, alcohol, and tobacco in their systems. Nobody was talking about that. So we started our substance-exposed newborn task force. And through that task force, we've done a lot of digging. We've done a lot of touring of facilities, and thanks to the hospital district, but also especially, and I don't think anybody from SMA is in the audience today, but there's a big stigma with people that are using. And if we could just get to the point that we understand it's a disease, it would be so much better. But there are so many women who get no prenatal care because they're afraid. Because they're using and they're afraid that their babies will be taken away. And yes, if the babies test in the hospital, yes, they are going to be. So many of our mothers that are pregnant get no prenatal care, so they become very high risk. Their babies are born substance exposed. So SMA now has a women's residential facility where very soon those moms that are pregnant and using will have the resource to be there with their babies at delivery, to have the ability to be healthy and to be good parents. So we've come a long way with that, but we still have a very long way to go with that. We run a lot of prevention programs through CASA, through our Community Against Substance Abuse, and we have SAD clubs, Students Against Destructive Decisions. We have 11 SAD clubs with 300 kids in them that are really trying to do the right thing and that are providing activities for our teens in the community. Friday Night Done Right, where we partner with the drive-in, we partner with the skating rink, so that our teens can understand that they can have a good time without alcohol and drugs. Mental health in our community and for our children is big. I don't think that I am saying that to anybody in this room that doesn't understand that. Just some numbers. Last year, the school system ended with 1,609 children and students in our schools that were homeless. And those are just the documented ones. So those children are coming to school and they're on survival mode. So getting them to learn is they're hungry. They just want a safe place to be. Last year in our elementary schools, 49 children were Baker Acted. 49 in elementary school. Also in elementary school, 84 high suicide risk assessments were done. That there were 84 children who teachers were very concerned about what the next steps were. There's a very large gap in mental health counseling in our community, an even larger gap for our children. There are not the mental health counselors available to help our children. So I'm hoping that that will change. So mental health, a very big issue, and we don't have an answer at this point for it, other than the fact that through our SKIP program, we are mentoring and tutoring. Last year we did over 300 children. And these are children that were identified by their teachers and their counselors as very high-risk students. Many of them already in the DJJ system with one offense. And so we're mentoring and tutoring, and we are having pretty good success getting those children to understand that there is another way. And our mentors and tutors are fabulous, and we are at 11 of our schools, several elementary, middle, and high schools. We also, the Department of Juvenile Justice, because gun violence is such an issue among our teens in our community, ask us to put a curriculum together to work with our students at Silver River Marine Institute, which is our alternative school. You are not sent to alternative school just because you had one fight. You are sent because you're violent or you've been using drugs. We are having success with our gun violence prevention program there. If I had time, I could share a wonderful story with you, but just know that we are having success. I have to thank Monica Bryant, who's in the room. Monica is on my staff. Our family violence prevention program, last year, we helped 178 families with emergency services, thanks to Monica and her staff and her team. That's 178 moms with children that are desperate, that are in need either because of domestic violence, they're homeless, and we have helped 178. And then we call Carla and we call April, and we're all trying to help these people. But the bottom line is there's really nowhere to put them right now. There's not a lot of places. We don't have a lot of options in our community. But we are here. We will always try to help. Thank you.
Thank you so much. Well, we have time for a couple of questions. When you raise your hand, we need a mic over here so everybody can hear, whether Rosie or Sierra bring a microphone. Sophia has a question. Anybody else, so that we'll be in line?
Thank you, ladies. So I know homelessness is one of the things that came up a lot, and I used to be the chair of the Homeless Coalition of Palm Beach County, so I do understand that issue. But I think what's key is the wraparound services, right? Because I'm sure most of the people who took the survey were not the homeless ones, and it's those women who we're trying to prevent from getting to that homeless space. So can you talk a little bit about in this county, what are the jobs that are available? What are, because those are the things that we're gonna need to, to prevent a lot of these women from becoming homeless, and the financial assistance, the financial lessons that's available to help women how to manage their money and all of those things. Can you talk a little bit about those services that are available to help?
I know at Shepherd's Lighthouse, what we do there is whenever the moms come in, we do an assessment. We find out what their interests are in life. Some of them want to be doctors, but it's like, okay, well, can we be a nursing assistant first and then move our way up? And so over the years, we've been able to connect them to certificate programs. This gives them a little bit more money than working at McDonald's, or nothing wrong with that. Nothing wrong with McDonald's. But that is one thing that we do. We try to get them into educational programs such as getting their GED. That is you have to understand, these are women, which you probably do understand, but these are women that have never had someone say to them, you can do it, you can make it, you can, they've always been beaten down. So it takes a little while to build that trust with them. But within 6 months, we've been able to get them into some certificate programs, then move them along. I want to say a good plug to the Early Learning Coalition. They also give away free diapers, and our kids would have naked butts sometimes if it wasn't for the Early Learning Coalition.
I really want to say one thing though, because I think it's a big stigma with homelessness. That is the people who are beaten down. There could be a homeless person sitting in this room at this event, and nobody knows that, right? Because they're sleeping in their cars, and they've lost their jobs, and they're trying to find a way up. So I really want to touch on, what's available in the area for those people, because it's not always the ones who are beaten down. Sorry, I just really want to drive that.
Emotionally, they're beaten down through their whole life, and those choices have made them sleep in their car. But we've also encountered women that have college degrees,
Right? Exactly.
And this has been more recent, probably in the last 5 years, that we have had more women with higher education that has been unable to find a job because they don't have a home, they don't have an address, they don't have a phone. You see what I'm saying? So there's a lot that plays into that. Thank you.
I want to speak to the job situation. When I came to Interfaith 13 years ago, it took months for our women to find jobs. Our local CEP has done an amazing job of bringing companies in now, but there still remains a barrier of transportation. So that is a huge barrier that these women have to overcome. There's some great jobs, on the fringes of our city, but they don't have a way to get there. So, we still have some of those barriers to overcome to address that issue you're talking about.
And I just want to say so we've just got about 2 more minutes on this question. We're going to have to end the panel, but the good news is they are all staying to answer more. So please go ahead.
Yeah, and so Career Source is an excellent resource, and we would be remiss if we didn't acknowledge them. And you mentioned stigma, and that's where I know that a lot of us have placed our focus on. It's just not being employed; it's about tapping into their talent. And we have several organizations too that I can think of: Advent Health, Zone Health and Fitness. There's places that have given these women stepped up and said, we're going to look beyond where you are and give them an opportunity, because a lot of times the homeless women stay homeless because people are looking at them where they are, not where they can be. And so we have some amazing organizations that are saying, let me meet them, let me give them a chance. But it takes us championing that all the time.
So I just wanted to quickly address your question as well. So the county partnered with the Ocala. So we now are the Ocala Marion Joint Office on Homelessness. So we oversee the continuum of care for the county. And the county is also partnered with the CEP to bring a business incubator into neighborhoods. We're talking about transportation issues, and so the hope is that now we're bringing in, I got tongue tied there, but bringing resources to communities where transportation is a challenge. So it's happening.
No, thank you. And the reason I asked that question is because, again, we want to make sure that the information we take away from these roundtables are the information that we're put in our annual report, so our legislators can see what does these areas need, right? So if transportation is it, then it's something that we need to address. So that's the reason I'm asking the tough questions, because I really want to make sure we're capturing those so that we can get those, to the people who make the decision.
Well, the other one is definitely low-income housing or affordable housing. And I forgot, I was remiss a minute ago, I forgot to mention that working in the shelter, we've seen that over and over. It's difficult to find housing for a lot of our clients, but also there was a desperate need for permanent supportive housing for people with disabilities. And so thanks to the county, we were able to acquire an apartment complex last year, and we have a 14-unit apartment complex where it's a mixed use. Some are permanent supportive housing with wraparound ongoing case management, and some are just very low income, where we cap the rent at $525 for a 2-bedroom. And for some of the mothers, that has been life-saving. They're able to go to school, get their degrees, and we've had 2 or 3 that have actually income certified out of the program because they're doing so well. But we need more of that, absolutely.
I know Carrie would like to speak, so go ahead.
Thank you. And another barrier we have to identify, of course, is childcare. So we get calls every single day with a mom who's found a job. She's so excited. We can't give her a voucher. There's a process and there's a waiting list. So unless we have someone who is verified homeless, they go to the end of the waiting list, which can be up to 200 long. So we get funds, we call people off the waiting list, but what happens is we lose a lot of those families. They've gone off to do something else. My concern is, where are these children? We have an identified need for children to receive care. Most of our families here are either a single parent family or working, or 2 parents working. There is a high need for childcare here, and most of our kids are not in any kind of licensed childcare. So we look at kith and kin situations. We want to make sure our children are safe. That's a big challenge. How do we find these children? And how do we know they're getting the right kind of care? So getting our families back working, the child care is a huge issue. Add in the transportation, getting the child to the center and then getting to work. It can be daunting for these families who have been just one paycheck away from disaster.
Thank you. Those were, thank you, Sophia, very poignant questions for this panel, and hopefully our legislators are, we can only do one, if it's real quick, one, okay.
It's actually, it goes along with this, and it's very quick because I know you had stated the CEP has the business incubator, the impact initiative. They're teaching people how to be business people. Are there, have you all partnered with them? Do you have the women go and take those classes that are free? Are there any places that they can go to learn computer skills, things like that they can start making money without having to get a GED, without having to take those extra steps that are helping them immediately so that they can better themselves?
So the Literacy Council is doing fabulous things in our community. And again, we refer to Career Source because they have the computer capabilities, and they are a true partner with the CEP.
Wonderful. So I want you all to give an absolute loud applause to these panelists. They will also stay after. They've got information in the back. Hopefully you have more questions for them. So thank you, ladies, so much. Okay. We're going to move 3 of the chairs off here, and I'm going to bring up the healthcare panel. So let me just move these to the side. I only need 3 up here. Oops, we took one too many. Here you go. Okay, we're ready for our transition, and this is going to be another exciting panel. So first, I'm going to introduce Dr. Don Bovell from Advent Health, Ocala, Ann Burnett, CEO of United Hands, and Deborah Velez, COO from Marion County Hospital District. Welcome. You guys are a powerhouse panel too. You might be fewer, but you're as powerful as this last panel that we had. So I'm going to start with Deborah, because Deborah is from the Marion County Hospital District, and your organization serves over 140,000 people a year. And what impactful services do you have that absolutely change lives? And I know, frankly, from talking to you, you could use this entire time because the services are so immense. But in brief, what do you feel you do to highlight the people of Marion County and, you know, how they can use those services?
Okay, thank you for having us. I said we're the dream team that up here, the 3 of us. So let me just start by talking a little bit about the history of the Marion County Hospital District. So the Marion County Hospital District was written into legislation in 1965. And the purpose of it was to ensure that people in the community who are underinsured or uninsured or just don't have the ability to seek services for medical, that they were able to utilize the community hospital, which used to be Monroe Regional. So in about 2014, the Monroe Regional decided that they no longer were going to be a hospital. So we leased the hospital out to Advent Health, and we got 40 years of lease payment up front. Really great financial decision by our 7 trustees who are appointed by the Board of County Commission. And huge amounts of money. We invest those funds. And so we kind of had to decide what we wanted to be when we grow up. And we had a lot of people coming at us wanting us to spend the money. And we had 7 trustees that were we're like, we've got to have this as a legacy fund for our community for well beyond everybody sitting in here's lives. And what we did was we decided that we needed to focus on 5 target areas that could impact this community. So those 5 areas, and it was based on a research study that was done. We focus on mental health, substance use, diabetes, obesity, tobacco use, and dental. And in those things, so we don't provide those 140,000 people that we impact. It's with many of these community partners that are in this room. So our population focus is every Marion County citizen, and those that are underinsured or uninsured, working poor. They have to be a Marion County citizen. And we also try to focus on areas and gaps in the community because we have such rural, and people talked lots about the lack of transportation in our community. So I'm going to highlight a few of our internal programs, talk a little bit about how we match funds so that we can build larger capacity within our community. And then I'll lastly talk about some of the strategic grants that we give out. So our internal programs is we have an active Marion project, and I have put flyers and all kinds of different resources in that back table. So our active Marion project is a community-wide project that can be accessed by anybody in Marion County. And the focus is obesity and diabetes. We do community education. We have some free diabetes classes that are coming up and that have information on that in the back corner. It's going to be at Freedom Library. We also have a proprietary app that will track steps, and we do quarterly step challenges. And we also do some free workplace wellness, because a lot of people, when you're at work, you're focused on work, but you're not thinking about your health and your wellness so that you can come to work every day and achieve success. So then we also have a program that we invest in called the Fitness and Nutrition in Schools. It's a partnership with the Marion County Public School System, and we focus on trying to teach kids healthier lifestyles. And we work with the school system on teaching kids how to grow their own foods. We also, in Active Marion Project, we do community gardens, teaching people how to grow their own foods as well. And we start out in elementary school teaching kids how to do raised beds, hydroponics, and greenhouses all the way in secondary education. And the kids now are selling their food back into the school system. Then we also work with them on the discipline issues that are within the school. Right now, vaping is a huge issue. There's kids even in the elementary schools where they've had issues with vaping and selling drugs even in the elementary school level this past school year. So we've been working with them instead of being we talked earlier about our alternative school, but working with them on actual intervention and prevention type stuff versus being more punitive. Like, why did this kid start vaping, and trying to work with them on that. And then we also work with kids about getting more active and being healthier. One of our newest initiatives is at Howard Academy, and it's called the Community Home Project. And we focus in that program, we have 2 caseworkers, and everything that I'm talking about is free. So that's the low cost of free. And so the Community Home Project is our newest initiative. We have 2 caseworkers, Monday through Friday, 8 a.m. to 5 p.m., sometimes later than that. We work with people on obtaining employment. So what are your barriers? Do you have the right outfit for that job? Do you have the right shoes for your particular job? We connect them we work with Career Source. We do employment fairs. Do you have transportation to get to that job? We'll give you bus passes, all the things to try to help that person. We also work on educational goals. We work with kids and provide after-school tutoring. We partner with an organization to do that. We do mentoring. We partner with an organization called Cut Different to do mentoring of boys. And then the school system does a mentoring program for the girls as well. We do medical and dental, and we partner with Freedom Clinic on doing clinics there. And then also we work on fitness and nutrition goals with the individuals. And Beth touched a little bit about Beacon Point. So Beacon Point, yes, it did come out of the task force, but it also came out of the need in our community. There's a huge gap in services because of the opioid crisis. And so we purchased a 6-building facility off of MLK from formerly known as the Centers, and we created this integrative healthcare system on one campus. And we provide a multitude of services. We're not providing it. We contract with people. They get free rent and utilities, and we also provide them with some funding to go along with that so that we can make sure that every service on that campus is free, so there is no obstacle or any barrier for women and anyone else to get services on that campus. So we provide outpatient mental health and substance abuse counseling. We have self-help groups, AA, NA, you name it. We have medication-assisted treatment. Those are the drugs that you take in order to kill the triggers of doing opioids. We do that for free on campus. We have behavioral health medication management on campus, so you can get, Heart of Florida is providing that, so people can go there, they can get their psychiatric medication, they can walk off campus with that for free. We have free primary care on campus. We have a dental bus that comes several times a week. We have detox, and we have 17 beds for detox and 28-day residential treatment. And then one of my favorite components of the program is peer support, those are individuals that are in recovery themselves for 2+ years, and they are available 24 hours a day, 7 days a week, trying to help people get into treatment. So if an individual is not really sure, or if someone has overdosed, and first responders will call that 24/7 line, or the hospitals will call that 24/7 line, and somebody that is been in your shoes at some point in time will come pick that person up and take them to treatment. They will find a way to get, and hopefully talk that person into getting to treatment. I have information about that 24/7 line in the back as well. We do a lot of, like I said, building capacity within our community. We do a lot of match funding. I'm not sure if you guys know this, but the county provides match funding to an organization like SMA, which is our Community Behavioral Health and for substance abuse and mental health. And about 2 years ago, our community was funded at about $9 million for substance abuse and mental health. And Lake County, which is comparable in size, was getting $17 million a year for the same sort of population and the same sort of services. Within the last 2 years, because the hospital district has provided match funding to the max capacity of SMA, we are now looking at getting $17 million worth of funding in our community for substance abuse and mental health, which is a huge deal. So we also provide we call low-income pool funding. So people that are uninsured or underinsured getting primary care in our community or dental care, we provide the low-income pool funding to the Heart of Florida, which is our federally qualified healthcare center, as well as Langley. And with that, they're able to serve, like, I can't even tell you how many people. So people that don't have insurance or underinsured can get their primary care. And by providing that low-income pool funding, they can draw down additional dollars for our community as well. And the College of Central Florida, phenomenal partner to the hospital district. We provided them with some funding so they could draw down more legislative funds to build the new nursing school here, as well as a dental hygiene program, so we can get more different employment opportunities for individuals in the community, because the closest dental hygienist school was in Alachua County, so now we will have one here. They're also opening up the new health science building that we help provide some funding to as well. The Mary Sue Rich, we provided $2.3 million to that community center so that our community can have some of the health and wellness that we all deserve. And then we do a lot of large scale grants within the community. I'm not going to mention all of them. Like Interfaith talked about the behavioral medication management as well as diabetes medications. We help provide funding to that. One of the greatest components that we added to that is if you do go to a federally qualified healthcare center, even if you don't have the funds to pay it, sometimes they require you to have a copay. So we provide them with the funding so that they can give individuals that copay so that they can make that first appointment. And then Faithfully Guided is an organization we work with. They do a free diabetes class that's coming up October 1st. If you know anybody that could utilize that service, please get in contact with them. And then this leads me to my last, one of our favorite partners, Freedom Clinic. And she is an angel on earth, as you all know, and it doesn't matter what. No job is too big or too small. And I do not know how this woman has the energy that she has. And Dr. Wovell, God bless you. But we provide quite a bit of funding to the Freedom Clinic to do the great services that they do in the community, because dental care was a huge crisis in our community. And I think with some of the funding that the hospital district has been able to provide, as well as bringing other resources to the community, especially with what Freedom Clinic is doing, we've been able to almost fix that particular issue, because there was no dental care in our community for people that did not have dental insurance or couldn't afford it. I mean, think about it. There's a lot of women in this room. I know myself, formerly as a single parent, we don't take care of ourselves, right? We just stick and move, and we get our kids to school, and we do all the things, and we have a lot on our plate, and our jobs don't start after we leave the office. It continues on well after hours and into the night. And so having these services available in the community is paramount for all of us. And hopefully we do start to realize that if we don't take care of ourselves, then we can't continue doing 1,000 other things that are on our plate.
So Anne, you couldn't have gotten a better introduction, angel on earth, right? So we are all sitting here wondering how you provide medical and dental care to the low income or those that don't have funds. Please share, because now after Deborah set you up, we really want to hear about your services.
Thanks, Deborah. Testing. Are we on the air? Yes, we are. All righty. So honestly, thank you, Deborah. That was amazing. It's so good to give flowers to the living instead of at my funeral. Now I know exactly how they feel about me, but thank you. So let me preface this by saying that Freedom Clinic did not just occur yesterday. It was actually the vision of Dr. Bovell. It was birthed about 28 years ago. Him and a colleague said, let's go do medical services in, foreign lands. He started with Jamaica. I happen to be Jamaican, so guess who had to plan it? Never had to do it before. So, and then when we moved to Ocala about 20 years ago, that's my husband. Anywho, about 20 years ago, he's a trauma surgeon, ER doc, ER physician, trained to do trauma, all kinds of weird stuff in the ER, right? Where you don't want to go, but if you need to go, you need him. He started seeing toothaches and chronic diseases for like years. He's a doctor, not a dentist. So over the years, we thought, well, we keep going overseas and there's a need here. What could we do? And wouldn't you know, God worked it out. Because the very first year that the hospital district was going to be doing grants, that's the year that Freedom Clinic that's a DBA of United Hands, which is a parent organization. That's when it was birthed, and the hospital district invited us to apply for a grant. However, before that even happened, that year, Carla, you were there, we had a mega clinic, and a Freedom Clinic represents free dental, optical, medical, and we provided those services. It was once a year. My husband paid for it and one other donor, praise God. And subsequent, after that, then the hospital district, they've been funding it ever since. Let me tell ya, it's an absolute blessing to be out of his pocket and into their pocket. But it has grown because people have toothache, they have dental needs year-round, not just once a year. We started doing it monthly after that initial mega clinic. And then they still have needs, and now we've evolved where we're practically doing it. If there are 4 Saturdays in a month, and there are, we have a clinic probably 3 out of those 4, if not 4. Yeah, clearly I don't have a life. This is my life. But anyway, so the services that we provide at Freedom Clinic, I'll start with really briefly with medical. And we're all volunteers primarily. Without volunteers, there's no way that the hospital district or anyone else would be able to afford the level of services that we provide for dental, but primarily all our services. But on medical, volunteers, the hospital district does not fund that. But however, the dental patients go and see those medical doctors because their blood pressures are too high, so we cannot do the extraction. And we need to get that resolved quickly, managed quickly, so they can get the procedure that they need. So routine services, but we're really a safety net. We're not their medical home. Our goal is to transfer them over to Heart of Florida or Langley, and that's been going amazing. Vision services, free exams. We partner with Ocala Eye. Y'all know Ocala Eye, the largest center in Marion County. Well, on a Saturday morning, they get up early just like we do to donate their time. And I want to personally thank Dr. Michael Morris. He's a huge champion. Not only does he travel with us internationally, but he does this here with us on a Saturday. So free eye exams, dilation. We screen for cataracts and glaucoma. And of course, free prescription glasses. And I'm not talking about recycled frames. Oh, no. Brand new frames donated by the manufacturer. So we're talking about Nike, Guess. I've even seen Salvatore Ferragamo. I cannot even afford their belt, let alone their frames. But thanks to Interfaith, talk about collaboration, they cover the cost for that. And it's really reasonable. We partner with a lab in Texas. The owner, optometrist, who's been traveling with us for years internationally. And it cost us, can I just brag on how God blesses? $20 for brand new prescription glasses. And thank you to Monica Bryant for also funding, helping to fund that. But the biggest thing we want to talk about is dental. Are we ready? Drum roll. What do we do in dental? Exams, x-rays, extractions. We try not to do those. Our goal is really to save the teeth. That's like a last resort. So we will do restoratives, otherwise known as fillings. We don't advertise this, so shh. root canals, because again, we want to save the teeth. How are we able to do all this? We have dentists who volunteer. We would not be able to afford them, but we also collaborate with the University of Florida. And so the dental students, they need the experience. We need the clinicians, and we've got loads of patients. So beautiful marriage happens on a Saturday. And that's how we're able to see a lot of people. But here's the cool thing. We're not a brick and mortar dental practice. No. Our model is mobile. Not really. It's more portable. That means we could come to this facility and set up all our portable dental units and transform this space to look like a dental office with dental operatories. We will also come to your church or your synagogue or your mosque. We've done it. This is what we do. And that's how we increase access. So we go to Fort McCoy at least once a quarter. We go to Dunellen. We go to McIntosh. We have not yet been to Bellevue in the 7 years that we've been in operation because there isn't a space large enough. We just need a gymnasium. So y'all work on that and call me. What? We do it on Saturdays because that's when the volunteers are available. Pastor Andre. Alrighty, so here's the neat thing that you need to know. The people who access our services are uninsured. They're underinsured. They look just like me and you. Some of them are homeless. That's why we also provide services right there at Interfaith. Thank you, Carla, for not charging us rent. We love you. But they're regular people. But here's the thing. For dental, you have to be a Marion County resident or be employed in Marion County. Did I mention we're funded by the Marion County Hospital District? We can't use their money to take care of somebody else. No. So that's how that works. And here's something really neat I want to share with you because folks are usually amazed at this. 60% of our clients or patients are women. 60%. Let that sink in for a minute. The majority of our clients, almost 50%, are Caucasian. Let that resonate. And then the majority of our clients, 65%, they are aged 30 to 64. These are the working poor. We don't ask for IDs. It's self-declarating because we provide sovereign immunity in collaboration with the Department of Health. Here's the other thing. We educate them. We're not just providing the services, but we teach them what to eat and what to drink. We push water. Thank you for serving water, not sugary drinks. Yes. We promote fruits and vegetables. So their program with the hospital district, it dovetails very nicely because that's in the school system and we don't want those kids to be our clients. So here's what I want to do as I wrap up because I want to make sure that Dr. Bovell has lots of opportunity to, to share the health information with you. Over on that table, you're going to see this beautiful flyer and it highlights all our services. And so you can contact us. But over the last 4 months, we've had over 5,000 inquiries for our services. 5,000. We started tracking it because our phones were ringing off the hook. So even though this has our telephone number, try not to use it. Please get this because I don't have enough staff. Use this flyer, right? And there's a QR code. Scan it, right? Scan that and you'll be taken to our website where you fill out the online form. It's a whole lot more easy for us to do that than to take a phone call. You can fill it out in 7 minutes. We extract the data. If you call us, we're on the phone with you for 15 minutes. See how many people we can help if you just go to our website. And then this is now in our ERs. Because 35% of the patients who come to us go to the ER. Did I mention there are no dentists in the ER, but they end up with a nice big bill? So now we have this posted, and again, courtesy of the hospital district, they are our inspiration. And then the final thing I want to mention, and part of United Hands, our parent organization, is not just Freedom Clinic as a DBA, but we also have Be Smart. And Be Smart is our health component where we do wellness. And at the new Mary Sue Rich Center, can I just thank you again for that building? We provide free Zumba classes. And I am your instructor. We want you to be healthy. We are reversing chronic diseases so you can stay out of the ER and take better control of your health, right? So come on out Tuesday, like today, 5:30 to 6:30, I'll be there. And yes, we're gonna make sure that you see the results that you want to see. So your smile will be improved if you need our services, and also your health. And that was literally 10 minutes, not 15. Ow, it went off.
Oh my gosh. So, Anne, you lived up to your title of Angel on Earth. And I'm thinking of your Zumba class. I could never keep up with your energy. So, but it sounds amazing. So we're going to move into Dr. Bovell. And I know for myself, I can't wait to hear on your tips and tricks of how to stay out of the ER, how to stay healthy, how working women that are giving so much to their families, how can they take care of themselves?
All right, thank you. So I'd like to say a few things. I'd like to thank Deborah with the hospital district because it's made a huge difference in my practice as an ER physician. Maybe 20 years ago when I moved to Ocala, I'd see someone who'd overdosed and I'd give them Narcan and they would wake up, and then what do I do with them now? I had really no place to send them. But now I've got a phone number that I can call 24/7. And I've actually seen these peer support people come out, talk to the person. The chances of someone after overdosing actually going into a program for opiate use disorder is very low, maybe 10% at best. So having the best time to actually make that impact is for someone to come out and talk to them at the time of service in the ER. And we have that here in Ocala, and that's a very unique thing, and it's a very great thing. So I'd like to thank the hospital district for that. So I was told by Commissioner Wells that I should probably tell a story. Okay, so I'm going to tell a story. I'm a guy, so it's going to be about a man. I'm sorry. But this actually was a story that made a huge impact on my life and kind of transitioned me from emergency medicine to what I would call lifestyle medicine. So about more than 20 years ago, I'm working in the ER. I had a very busy shift. You know, all night, people were coming in, kids, heart attacks, strokes. And it's the end of my shift, right at the end. I've got 15 minutes to go. If you know anything about ER physicians, at the end of your shift, you're like, don't talk to me about anyone unless they're dying, because I want to go home. The nurse comes up to me and hands me an EKG. I don't want to look at it, but I look at it, and it shows signs of what we call an ST elevation myocardial infarction. This person is having a heart attack that I can see on the EKG. So I go over to this gentleman, and he's about 50 years old, white male, laying in bed. He's sweaty. He doesn't look good. His wife is sitting right next to him. She looks nervous. And I say, are you having any chest pain? He says, no, not really. I just have a little indigestion. He don't want to come into the ER, but his wife made him. Thank you, women, for making your husbands come in. And also, the wife actually gave me a better history than he did. Thank you again for that. So she was saying that he woke up, he was there all night with indigestion. As I'm talking to him and I'm taking the history, all of a sudden the monitor starts wiggling and he goes into this thing called ventricular fibrillation, which means his heart isn't pumping and the electrical rhythm is just abnormal and chaotic. It's not communicating to the heart muscle. So he becomes unresponsive. And this is actually quite a while ago when we actually had the defibrillator, the things that you put on, the paddles, not the pads, much more fun. So we put the paddles on him, shock him, he comes right back. And I said, are you having any chest pain? He goes, no, I'm not. And he actually does that about 2 or 3 more times in the ER. We get him stabilized, he's on lidocaine. Now this is not very memorable. You might think it is, but I've had a lot of patients like this. What's memorable is this gentleman asked me, why is this happening to me? I rarely ever have patients ever ask me that question, and I would love for them to ask me that question. And I said, do you smoke? He says, yes, I do. Well, you got to quit smoking. I said, what do you do for a living? He says, I'm a truck driver. Just a note about truck drivers. If you ever see a truck driver in the ER, I tend to admit them to the hospital because they don't like to come to the hospital. They have to work to make money. So if they come to the hospital, chances are they think they're really sick, and they probably are. So I said, you probably eat at those truck stops. He says, yes, I do. Stop doing that. Just eat more vegetables, drink water. I said, what do you do socially? He says, nothing really. I said, what does your wife do? Does she go to church? He says, yeah. I said, go to church with your wife. Literally, I told him these 4 or 5 things. Now, there's a lot of research behind what I told this gentleman in 5 minutes. social isolation, loneliness is as bad as smoking 15 cigarettes a day. Okay? Smoking, social isolation and loneliness. Smoking 15 cigarettes a day. They've done, these guys much smarter than I have done research about that. Fruits and vegetables, those green plants that we leave in the crisper in the bottom of our fridge that spoil when we throw them out. I just take them out and start eating them because they have the most nutrition out of all the other foods. And I told him to start walking with your wife. I said, once you go through cardiac rehab. So, I see this guy, and again, I would not have remembered him. But 6 months later, I'm working in the ER, and they're like, Dr. Rovell, someone's here to see you. And I'm looking at this guy, I don't recognize him, he has a suit on, and he's smiling and beaming at me, and I'm thinking, well, he's probably not a lawyer with a subpoena. So, that's literally what I thought. So I walked up and said, hey, do we know each other? He said, yeah, you took care of me. I'm the guy that had the heart attack, and you told me what to do. I'm like, yeah. I said, yeah, you look great. He said, I did everything you told me. So that made more of an impression on me, I think, than it did on him, because it really brought home the fact that a lot of these lifestyle diseases, all of them, are potentially reversible. Type 2 diabetes is a reversible disease. High blood pressure is a reversible disease. And these very simple things that we can all incorporate into our lives on a daily basis can make have an incredible result. And I think part of the message that I would say to women and men is, be active, get out there, socialize, play with your children outside in the sunlight. Let's not be scared of the sun. Vitamin D is good for you. Just do it judiciously. Let's eat more vegetables. Let's get more social connections. Hey, let's have dinner with each other like we did when I was growing up as a family. Let's start doing these things. These very simple things have a powerful effect on your health. And so start incorporating these lifestyles ourselves into our own lives, number one. Number two, become involved with health activities in the community. We've heard from a lot of panelists today about homelessness. We've heard about early childhood learning. Get involved with those things. Get involved with your kids' school. What kind of lunches are they getting? They're probably unhealthy. I shouldn't probably say that. But really get involved and find out what your kids are eating at school, because I've actually gone to some schools and I see what they're eating and it's not good. So get involved, be active, and become an advocate for health.
All right. You still have time if you would like to give us a little more information.
So I told Commissioner Wells that I can speak for 10 minutes or an hour, so if you guys want to speak, right? So, just getting into some specifics, I think if I were to, the one concern I have, or several concerns that I have about health is, sugary drinks, added sugar. We all know this. Added sugar is a major problem with our food supply. And the American Heart Association, and the American College of Cardiology, recommends that we should not eat more than, I think it's 6 teaspoons of added sugar a day, which is about 24 grams. If you look at the average beverage that we get from the store, juices, drinks, sodas totally unfit for human consumption. It's one thing that I tell people not to drink. So you can knock yourself out and try anything else, but water should be your main beverage. I've had patients that I have told, cut out Gatorade, cut out juice, cut out soda, and they've lost 30 pounds in a month. Their blood pressure has improved. So that's one thing. Added sugar, tobacco. And this may not be popular, but I'm going to say it. I'm going for this. Alcohol is not a health food. So I'm going to put that out there. If you're drinking alcohol, it's not great for your heart. It increases your risk of breast cancer. It increases your risk of stroke. I've never seen anyone get into a motor vehicle crash because they ate too much kale. But when you become intoxicated, it suppresses your cognitive ability. On a long-term basis, it also causes cerebral atrophy. I've seen the CAT scans and MRIs. It also causes cardiomyopathy, which is dilatation of the heart chambers. So it's not a health food. And that's something that's not very popular in America because the data that we're looking at is very flawed. Some of the data that we have, we actually put people who are never drinkers in the same class as non-drinkers, people who used to drink and then quit. So that's what we call a confounding variable. You can't really put those people in the same class. So you kind of think you're seeing evidence of benefit of drinking alcohol, but it is not a health food. So I would say less sugar or no added sugar would be great. And consider alcohol not being a health food and do more research into that because I see a lot of the negative effects of what I'm saying. This isn't like stuff that I read in a book or read in a newspaper. This is stuff that I see in the ER every day. And I've seen people reverse the effects of these lifestyle habits by changing their lifestyle habits. I used to volunteer at a place called Phoenix House. People are there for opiate use disorder. They're there for alcohol use disorder. So, there's got to be something, right?
A vegan point, we see a lot of people think we're going to see people for opioids. You're correct. The majority of people are there for alcohol use, and the opioid just comes into play after. Nobody starts out with an opioid, right?
Yeah. Also, the marijuana is not what it's. We're really offensive people now, but again, recently I've been seeing a lot of people coming into the ER with there's this thing called cyclic vomiting syndrome, and they just keep throwing up and they can't stop, and it's one of the effects of marijuana use. So, so it's kind of keep educating yourselves on your own health and start doing something today. How many people are going to go to Anne's Zumba class tonight at the Mary C. Ridge?
Come on, y'all!
It's free. No one, not one.
How many people have the trade
All right, we go on, yeah. By the way, for a Zumba class at Mary Sue Ridge Center, I've got Nurse Dawn back there. She was working in the ER with Dr. Bovell for decades. She's now retired. We take your blood pressure and we weigh you in. She does that. So we're seeing bodies being transformed. We started the class January 16th, right after they opened up that new building. And it literally took from that date until, when did you start seeing changes in their blood pressure? And it took that long, right? But consistency is the key, right? And okay, quick plug. Come on out to the Mary Sue Ridge Center, it's really good. But quick plug, Dr. Bovell said soda is just unfit for human consumption. Literally avoid soda. If you're entertaining, just serve water like you did. Tea. Hey, I'm okay with it. Soda has
not sweet tea.
Yeah.
Don't try to slip that in. Not sweet tea.
Soda, Long Island iced tea.
So over at Interfaith, we saw patients, and we had a dentist who saw patients saying, "Hey, she was asking the patient, do you use substances?" And the patient was like, "No." But the teeth were all rotted and bombed out, like for real, the entire teeth, uppers and lowers. And so the dentist was confounded. Now she's a dental student, actually a resident. She was a resident. And so I took a look at it and I go, I asked the patient, "Do you drink soda?" She said, "Yeah, every day." And I said, "Particularly, do you drink Mountain Dew?" She said, "That's my favorite. I have like 7 bottles a day." So I quickly Googled Mountain Dew mouth, and I showed the picture to the resident, to the dentist. And I go, "She's not using crack cocaine, meth, or anything like that. She's drinking Mountain Dew." So we teach every patient that comes through, Grace Daly, if y'all know her, she does the sugar show. you'll see teaspoons of sugar attached to all your favorite beverages. And it's like a visual that indicates to you how much sugar is in that one beverage. It would be shocking. Mountain Dew has, I want to say, 70 grams of added sugar.
We do the Eat Healthy, Be Active, and that's a community education class. You follow us on social media or go to our website, you can find out what the classes are. We do the Advent Health will do the diagnostic testing in the beginning, like all your levels at the beginning, and at the end to see if they'll help you read labels telling you like what is to avoid and what to stay away from. The same with the diabetes classes, but it is impactful to watch people's progression once they start paying attention to what they're putting in their bodies, because food is medicine.
So I have a question before we start the Q&A, and that is that many times, for families, it's expensive to eat healthy. It's probably the most challenging thing when you're going to the grocery store or whatever. What kind of advice can you give when you're trying to let down or stretch how they can begin to be healthy and quickly? Quickly it's like easier to go get something that isn't healthy. What can you give us for information for that?
At our community home project, that's one of the classes that we teach there. Is a lot of people, like West Ocala is considered a food vendor. They're not a grocery store within a mile. It is, sorry. But one of the classes that we teach there is how do you order groceries online? How do you make healthy food choices on the budget? So it's possible, and then teaching people how to grow their own foods. How do you grow your own foods? Because it's expensive to get anything these days, like a gallon of milk or whatever. It is tougher to eat healthier. So learning those different tricks of the trade and how to make things stay longer and fresher, like Dr. Robel was talking about how it turns brown. They give you some tips on how to make your foods last longer at some of the classes that we teach at the Community Home Project. So there are ways to do it.
Also, farmers market, packet of beans, 99 cents. If it's on the WIC program, trust me, you can afford it. Things are healthier foods can be inexpensive if you just view it differently. Let me tell you what's really expensive: healthcare, being hospitalized, right? Having triple bypass surgery. Well, you all know what I'm talking about. You do, right? Here's something really cool. This is for my ladies. I'm just going to say it really quickly. Going back to soda, if you cut out soda for just 10 days, you will lose 7 pounds, guaranteed. Everyone who has tried it in my class and patients who come to the clinic, they come back and they tell me it works, except they lost 10 pounds. I'm just saying 7. I'm conservative.
What about Starbucks?
The whole point is the added sugar, the refined sugar. It's the same philosophy. Orange juice, just drink water.
So I'm going to ask a question. What's the number one chronic disease of childhood? No. How many guys are moms? Number one chronic disease of childhood. Who said that? Who said cavities? Yes. Dental cavities, the number one chronic disease of childhood. So, that's kind of like a window to your body. If you've got cavities, other stuff is going on. They did autopsies of young men who were in the Vietnam War, and they found fatty streaks in their blood vessels that were starting, and most likely died of it. So, the high sugary drinks, they cause dental cavities. This is why it's very important for kids to get screenings every year. Half the kids on Medicaid probably don't get that annual screening exam that they're supposed to get. A lot of physicians or dentists don't even take Medicaid, so some people have to go out of town to their so-called dental provider. We have actually much better dental care in this town than other places that I work. So the thing about sugar, added sugar, the reason why we're talking about it so much is because, again, I see the results, and I see little kids with dental cavities And if they have their primary teeth, okay, but if it's their secondary teeth, that's the teeth they're going to have to live with for the rest of their lives. That's not such a great thing. And it's not a great thing with their primary teeth either. The other thing I was going to say, I'm going to push back a little bit on eating healthy is expensive. Maybe if you eat like a lot of the processed vegan type foods, it can be. But we did a mission trip to Guatemala maybe about 10 years ago, and we were out in the Andes, and we keep records of all the patients we see. We saw about 960 people. And I only saw 2 cases of diabetes and 1 case of high blood pressure. And we had interpreters, young people from Guatemala City, which is the capital, who were interpreting for us. And I said, hey, you guys are in Guatemala. You guys are healthy. And he started laughing and said, no, we're just as unhealthy as you Americans. He says, the people out here, they're local people, they're farmers. They basically eat rice, beans, a little bit of meat, don't drink any processed foods, they can't afford soda or chips or anything like that. So, rice and beans are relatively expensive, and you can get some deals on vegetables. I don't know, especially the ones that are in the packages. So I'm going to push back a little bit on eating healthy being expensive. I just think you need to do a little bit of price comparison at the store. And again, there is a problem with food deserts, and it's the initiative of the hospital district, helping kids grow their own vegetables and those types of things. That's something that's great. Get kids involved better. So
that's just such great information. So I'd like to open it up for questions from the audience. We'll make sure we get a mic to you. Okay, there's one up here in front. We want everyone to hear. It's actually for all of you here. This is being recorded, so we can, I believe, send a link from the emails list that we've gotten if you would like to see this. It'll be on our website. It'll be on the website. Here we go.
I just want to thank you all for your time and expertise. I've found that this has been very informative. I want to pick on Deborah just for a minute. I do have a question. I'm with Marion Senior Services, and as you may know, the senior population makes up about 1/3 of our population here in Marion County, many of whom are women. We as an agency try to be proactive versus being reactive. And so with that being said, does the hospital district currently fund any programs specific to seniors, or do they have a plan in place for how to tackle the growing need in our community for those services?
So I actually have met with the CEO several times from Senior Services, Jenny. And so we have been trying to partner with you on some different initiatives, but all of our programming is offered to all populations and all ages. So we have recently been targeting with our Active Marion project out into the on top of the world and to the senior population to try to help with diabetes education, eating healthier, being active. But that is something that we've been trying to work on. And I know we've had some staffing issues with Senior Services recently, and she said she would reach back out when she was able to. Mm-hmm.
My question is back to the sodas. I don't drink soda, but you have a lot of individuals that do, but they drink the zero and the sugar-free and all of those other types of soda. How are they?
I'll take this one, Doc. Okay, so let me tell you, the food and beverage companies, they have done a doozy on us. Like, their marketing is amazing, right? So they know that you might be a little bit onto them about the added sugar and the ill effects of that. So they're just trying to hoodwink you and say, oh, 0 calories, oops, 0 sugar. Well, why does it still taste sweet? It ain't natural now, is it? I want to know, let me back up. If you go back to the Garden of Eden, right? Everything was grown out of the ground or on a plant or on a vine. And God said, of all of that, eat freely, drink freely, had springs of water running through the garden. I got to take it back to the basics. We need to get back to the basics. So if it's from a plant, like with leaves, eat it, drink it. If it comes out of a plant with a smokestack, a building, run, because you're going to keep him in business and keep me in the lifestyle to which I've grown accustomed. If that's what you want, do it.
Yeah.
But I highly recommend drink water, avoid those sugary drinks, especially soda. It's literally not good for you, but it's the acid too. The acid is eroding the enamel of your teeth.
Yeah, there's a lot of research that shows that people who drink those 0-calorie drinks, they actually don't end up losing any additional weight because they end up like eating other sugary foods. So it's, there's a lot of research that shows that. That's number one. Number two, the amount of chemicals in those drinks, and some of the adverse effects are just coming to light. And so, there was a physician, William Osler, I think years ago, 100 years ago, who said, as a physician, don't be the first person to do a new procedure and don't be the last person, So don't be the first person to drink a new 0-calorie drink because you don't know what's in it. And again, the research has shown that a lot of these 0-calorie drinks, they don't achieve the goal that people are pursuing, which is weight loss. So, and then you have, again, the detrimental effects of the chemicals.
More thing, so we all want a quick fix, don't we? So that we can look like the Californian model. I'm just saying. However, there's no silver bullet for that. It has to be sustained lifestyle change. And it's really what goes in your mouth, but it starts right here. Your brain has to change, and then your taste buds will come along. I promise you, try it.
And you got to move, right?
Oh my goodness, you got to be physically active. In fact, what's the best exercise that you can do for weight loss? Walking? What else? That's good. Zumba, you're funny. I love you, girl. What else? Swimming, biking. All right, I say the best exercise is the one that you will actually do and do it regularly.
Is it on? You expressed that eating healthy, there's a lot of single parents that can't afford the, well-grown vegetables, and they have canned good vegetables. Is that, which I know because I'm in nursing as well, is that good for some people that don't know that canned goods are not as good as the fresh vegetables?
Yeah, disclaimer, I'm not a nutritionist. But I will say that probably fresh or frozen would be better than canned vegetables. Some people even say frozen is better than fresh, depending on, what type of vegetable it is. So I would.
Or organic, because it doesn't have because anything that's in a can, there's a reason it has a shelf life. And so they're putting all the preservatives and whatnot in it. With something that's organic, you're not going to have all those preservatives. It has a shorter shelf life, so that may be better than your regular canned vegetable.
In water. Mm-hmm. I was just going to say that through osmosis, if all you have, because I noticed at the dollar store they're selling canned vegetables, peas and beans, and I get it, it's really cheap, but you're correct. Soak it in water, and through osmosis, the sodium, because that's really that's the major issue with canned goods, the high sodium content. It will reverse, but I would say wash it and soak it at least 3 times until the water does not taste salty. It needs to taste fresh, and the vegetable itself tastes fresh, and then you can add your own seasoning and a little bit of sodium.
I think we need Grandma to come teach some classes at the Community Home Project for us, please.
We have another
ingenious.
question in the back here.
So my name is Andre. I'm the pastor of the Bellevue Seventh-day Adventist Church. And I think you guys can answer this question for me as to the percentage of faith-based, the faith-based sector in Marion County. I'm relatively new here, so I'm not sure about that. The reason I ask is for both the financial and the healthcare initiatives surrounding care for women, the faith-based community can make such a huge contribution. Like we have 6 acres of land at our church that if it was zoned right, we'd be willing to put modular homes on those 6 acres to help with a problem. We have many buildings that could be used for childcare. You know, that was another need that was here. So I think with the right motivation and the right approach, the faith-based community could be mobilized to meet a lot of these needs. We have land, we have buildings, we have volunteers, we have weekly promotions for funding, which is a very unique resource. And for example, we have a person in our congregation who's a health coach, and he's written curriculum to train our members to be health coaches that can be free to the freedom clinics or to any organization that really needs to train people with these simple, like Dr. Bovell is mentioning, simple things of helping people change their health habits. So I know you guys have been working in the community a long time. What percentage would you say of all the hundreds of churches in our county are engaged in the greater good here?
Well, I don't know if anyone knows that. Do you know? You want to venture a guess?
I know that we fund a lot of organizations that are faith-based, but I couldn't tell you the percentage.
But I do agree with you in that the faith-based community, the churches, the synagogues and mosques, their buildings tend to be the most underutilized real estate in the whole county, if not all of America. And I firmly believe that our churches, being that they're in every community, right? Every community should be a center of wellness. A center of wellness, not just for health, yes, physical health, but spiritual health and absolutely financial health. So, pastor, you need to get with your other pastors and tell them, let's go. Uh-huh. Good deal, we'll be there. So one more, actually we had another Adventist church who did that literally, but they were in the process of renovating their church, so it worked out perfectly. But that's the reason why we partner with churches and we go to them and we utilize their space. And all the pastors say this 100%. They get them, that's the only time that the community comes to them, because the community isn't coming to them on a Sunday morning. It's just the members who are from different parts. And go in.
And how do we get you rezoned? That's the question. We got people in this room.
I love that.
Well, Marion County.
So I think that actually rounds it up pretty well, because what would be great, as we end this program, as you know, they're going to all be here, I think, connecting and talking, to be able to do that. And, you know, first off, I want you to give an amazing welcome to this panel. And, yes, we had terrific panelists, from the financial panelists to the healthcare. I'm hoping you will stay and chat with them. The commission has taken notes of different things. We'll have a recording to bring it back. We will also be here if you have things you want us to bring back. As Sophia mentioned, for our annual report, you know, our whole mission is women and girls in making, which ultimately makes families better. So on behalf of the commission, I want to thank each and every one of you for not only coming, but those of you that really helped make this a success. Natalie, again, thank you for you and the CEP. We couldn't have done it without you. Each of the panelists who took their time to make sure they did a presentation, the Weber Center, which has just been wonderful for this. So I want you all to have a blessed, wonderful rest of the day, and please stay and talk to our panelists. Thank you.
I'm not used to it. I'm usually Thank you so much for the opportunity.
You all were so wonderful.
Deborah, that's great. Right? Thank you.
And I'll tell you.
We said you had great.
I guess I'm just gonna